Hey guys, welcome back to the First Methodist Shreveport podcast. I'm here with Laura Gauthier, Program Director at the Bridge Alzheimer's and Dementia Resource Center. How are you, Laura?
I'm doing great. How are you?
Doing good. Feeling good that I got past that introduction. That was quite a mouthful.
Yes, yes it is.
Good. So, how did you get to where you're at?
So I am by trade a licensed professional counselor, and I was a school counselor for 6 years.
Oh, wow.
So did a little 180 with working with kids, but now I work with families with dementia and Alzheimer's. But that niche and that the geriatric community has always been a passion of mine. Found that out when I was in grad school when I worked for a geriatric psychiatrist in the area. And went a totally different route after I graduated grad school, but have now come full circle because he was the doctor that actually told me about this job when it became available last year.
Oh, wow. So were there any similarities between doing school counseling and counseling people with Alzheimer's and dementia?
Sometimes, obviously the administrative duties are a lot different, a lot less paperwork that I have to deal with.
Yeah.
But it's all kind of in a way it's the same because I'm providing a warm, comfortable, no judgment environment, and that goes across the board, whether it be for kids, adults, caregivers, anybody that is looking for help or just reassurance. So.
Okay. Did you have like a specific grade school age you worked with at a school?
The last 3 years I did elementary, so I did kindergarten through 5th grade, but overall I did kindergarten through high school.
Oh, wow.
So I did a little bit of everything.
Goodness. What was the high school interesting whenever you were working with the high schoolers?
They definitely could be, yeah. But they're typical high schoolers, so.
Yeah, I can imagine. Well, that's awesome. So you said that the teacher you had was the one who pointed you in the direction of going to work with Alzheimer's and dementia?
Doctor, yeah.
Doctor, okay.
So he was I was fresh into grad school and was looking for a job and ended up getting placed in his clinic at Willis-Knighton. And it was just sheer happenstance, and it was the perfect match because he was not only a great boss, but a great teacher, and I fell in love with the geriatric community and people with Alzheimer's and dementia. And so, I heard the same stories over and over again from the patients, but I loved working there. It was literally, it was different every day, even though it can be a struggle, but it was very rewarding being in that position and that job.
Nice. So what does the Bridge do for the Alzheimer's community?
So we are a local nonprofit that helps families diagnosed with dementia and Alzheimer's find the right resources, navigate the disease, if they need help with facilities, home health, hospice. Me as a counselor, I offer counseling services. We have caregiver support groups. Anything and everything that families might need, we can help them get in touch with the right people, legal, financial, or if we don't know, we're going to research it and figure it out for them. And the best thing is everything is 100% free.
That's awesome. And so I'm assuming it's a nonprofit.
Yes.
Okay. All right. And so how do y'all get patients? Like, are there people that refer people, or is it like counseling centers who a family might go to a counseling center and then that counseling center refers them to you?
Yeah, so a lot of it is word of mouth.
Okay.
We do a lot of outreach in the community. So we go to local, churches, community centers, councils on aging, health fairs, and just let people know that we are here, we're available, and that we not only service Caddo-Bossier Parish, but we service Region 7. So we go all the way over to Bienville down to Sabine and Natchitoches Parish.
Oh, wow. Is that 9 parishes?
Yes.
The only reason that I know that is because we recently talked to someone in the Renesting Project, and was something I had a hard time getting. So Region 7, 9 parishes.
Yes.
Okay.
But we don't just, we don't say, oh, you live in Lincoln Parish or you live in Monroe. We're not going to help you.
Yeah.
No, we're dedicated and, quote unquote, in Region 7. But if someone calls us in those areas, we're going to help them and try to find the resources in their area as well.
Yeah. Okay. And so I guess if someone from Ruston called and said that they had someone they knew with Alzheimer's and dementia, what would be the process of y'all helping those people?
So we would really get any and all information that we could from them to see what's best, what are their needs, if they need a sitter, if they need, a day center, a facility, anything like that. Then we would take that information and really do the legwork, the research for them, find all of those resources, either call them back or email them and say, this is what I've found, this is what's available, and here's the names, numbers, anything that they can use to contact.
Okay. And so I guess what do those situations look like? Is it usually someone trying to help a family member, someone trying to help a friend, or?
Usually is a spouse or a child calling us, and they're concerned about memory issues. They've seen some things, but they're not really sure. One of the things that we offer is free confidential memory screenings, and it's not a diagnosis, but it's a good place to start when you don't know where to start. Yeah. And they can come in and get that screening done. They get a results sheet, and if they are below the normal level, then we can say, okay, let's, take this results sheet, go back to doctor, let's roll out the physical aspects that can cause cognitive issues. And then, once the doctor rolls out those, then y'all have conversations about the next steps. And then once y'all do that, if y'all still have questions, y'all can come back to us and we can do like a plan of care, figure out what things you need to do, like powers of attorney, living wills, all of that fun stuff. And then, really just be there with the families every step of the way so they don't feel so overwhelmed.
Okay. And so what are the physical aspects of someone's life that could cause like those memory loss issues or things like that might make them think that someone has Alzheimer's or dementia?
So in the geriatric community, urinary tract infections can cause cognitive issues, depression, vitamin deficiencies, thyroid issues. Let's see. Hospital stays with anesthesia can cause cognitive issues. So there are lots of physical things that can cause cognitive impairments. Most of the times they will come back. If they come on really sudden, it's usually a medical issue. But if something that's going on little by little, 2, 3, 4 years, it could be dementia.
Yeah. Okay. And so I think we might have answered this before, but so when someone gets in touch with y'all mainly go through like a screening process to find out what the issue is as far as if it's a physical impairment that's causing the Alzheimer's or memory loss. And then, so let's say you do discover that they do have Alzheimer's. What's the step from there? So
we don't actually diagnose them.
Okay.
We are just, as a resource in helping them get all the information that they can. We use that information to further along the process of, what do they need help with right at that moment?
Yeah. Is
it, do they need a neurologist? Do they need a doctor that can look into further this? Do they need a primary care doctor? If that's the case, we can help them get in touch with some doctors. There's lots of doctors in the area, particularly primary cares, that are taking new patients. So we can help them get in touch with them. Or do they need, somebody a sitter because they're having cognitive issues with their person, but they're not really sure. They're not officially diagnosed, but they don't want to go to the doctor.
Yeah.
So that's a thing that we see a lot of as well. So we just really find out what their most important thing is that they need help with. We work with that, and then we start working on the next things or the next important things after that.
Okay. So I guess y'all are there as more, I guess, like it says, a resource center
Yes.
to be the people who know and understand Alzheimer's and dementia and can help a family navigate how to better serve the person that they know who is going through potentially who has Alzheimer's and dementia.
Yes.
Okay. All right. It's starting to click now.
Yeah, we're there to guide them and be with them and work with them through the process and the long journey.
Yeah.
So we're creating a community where no one affected by Alzheimer's and dementia makes the journey alone.
Mm-hmm. And like you said, that no one makes a journey alone, and I'm sure one person or both people benefit from y'all's resource center, but is there usually one person who benefits the most, like the person who's the caregiver, or is it usually a person with Alzheimer's and dementia that benefits from the resource center?
It's a little bit of both. It may be a little more caregiver benefits than the person with dementia because we do our caregiver support groups.
Mm-hmm.
We do lots of programs. So we do an educational workshop at the first of the month. And, those caregivers get great information from experts in the area. But what we also do recently is we have started saying, bring your person with dementia if you can't leave them at home or if you don't have somebody we're with them. We have structured activities to do with them during that time. We have volunteers that come and do that as well.
Mm-hmm.
So they don't have to worry about their person during that hour, 2 hours that they're gone.
Yeah.
And then we've got we do drum and art activities. We have classes that we've partnered with North United Methodist.
Okay.
And so we do art classes, drum classes, and those are for the caregiver and the person with dementia. So, and they both benefit from all of those as well.
Yeah. So art and drum classes, like how do those help with Alzheimer's and dementia?
So art and music are really good for the brain because they get them thinking outside of the box, especially with art because you can do something with your hands without thinking about it, and they don't have to really think and focus on something. They can just do it. And music is really great for someone with dementia because that's literally the last part of the brain that actually deteriorates. And so they really resonate with it, and the repetitive beats and things is very soothing to their mind and to their brain.
Makes sense. And so those things, I guess, could they be used as preventative measures as well? Like for people who, I guess, want to make sure they don't or improve their chances of not having Alzheimer's and dementia, is being involved in art or doing music and stuff a good idea?
Yeah, because it's working your brain. You're creating new pathways in your brain. So anytime you learn something new, your brain's going to create a new pathway, a new way to learn something. So it's not using that same highway kind of mentality. You're using those side roads, and you're creating those side roads. So when the highway goes down, it has the side roads to go around.
It's a great analogy. I love that.
So music, art, learning a new hobby, learning something new, challenging your brain on a daily basis is really good to keep your brain active. It may not prevent it, but it can definitely reduce your risk and maybe put it off for a couple of years if you're already at risk for it.
Okay, that makes sense. So what kind of art would you suggest people do now?
Oh, gosh, anything that inspires them. I do paint pouring, so it's very abstract, but you never know how it's going to turn out, but it's very therapeutic for them as well.
Okay.
Because they're enjoying that in the moment,
Yeah.
and they're not worried about anything else.
So is it like just literally pouring paint on a canvas, or?
Yeah.
Okay.
So, and
That's
you're
nice.
watching the colors. They have an additive in them, so they don't actually mix. They sit on top of each other, and so sometimes it creates like a marbling effect, or they are in each other, and so you've got the colors not mixing with their sitting, and it's very therapeutic. It's really neat.
Nice. I like it. And so the counseling aspect of Alzheimer's and dementia, I know there's no, like, usually whenever you go to a counselor, you're trying to work something out and get to some sort of a end or resolution or work out how you're feeling. How is that different with Alzheimer's and dementia?
So It's different for the caregiver, but also for the person with dementia. So when it's the caregiver, we're helping them process what's going on, give them some coping skills for themselves, some techniques and communication skills to work with their person with dementia so they can have the best quality of life and not get so frustrated. I mean, nobody's perfect. You're going to get frustrated with anybody that you're married to.
Yeah.
Or anybody that you're related to. So,
Fact check, true.
We really just work with them and, teach them different skills and things so that they can have the best life and be happy. The person with dementia, we're going to work with them and, also help them process what's going on, but also teach them some modification things to do to make their life a little easier, because the one thing I always tell the people that, have been either diagnosed or have concerns, you've got this thing, but it can't define you. You're a person who has dementia. You're not a demented person.
Yeah.
So don't let this diagnosis define you. You have to work it into your livelihood, and you have changes and modifications you're going to have to do to your life and to your schedule and to your structure. But you can make those small changes and have your person there to help you make those changes and keep you on track. And it makes life a little easier and less hectic when you're willing to change those little things for those modifications.
And so is it best to do those sort of counseling sessions like together or one-on-one or individually?
It helps to do them both ways.
Okay.
Because, the person with dementia is trying to understand for themselves that their life is changing, but their marriage aspect or their relationship with their parents is changing as well.
Yeah.
So it's good to have the meeting together so that they can both work on things that can help each other and not fight against each other.
I guess it also takes away that excuse of, well, I don't remember that.
Yeah.
Have you ever had to call out a patient on that? Like someone who has dementia and their spouse keeps bringing up, you don't do this. And you're like, well, I just don't remember.
And it does.
Like they use it as a crutch to get out of certain things.
It does happen. And, I sometimes don't even acknowledge it. And other times I tell the caregiver, is it worth the fight? To constantly be saying, well, you said you did this. No, I don't remember that. Is it worth the struggle to fight about it?
Yeah.
Or is it easier just to let it go?
Yeah. It's probably easier just to let it go.
But we're human and we don't always do that. So if you do it 6 times out of the 10 times, you're doing pretty good in my book.
Yeah. And so what are the things that most caregivers struggle with whenever it comes to having a spouse with dementia or Alzheimer's?
The hardest thing, I think, is really the relationship change. And, you've got 2 people doing things, and now it's more, things are really heavily weighted on the caregiver with bills, yard work, housework, doctor's appointments, all of that. It's really heavily weighted on the caregiver, and they can get very overwhelmed.
Yeah.
And the struggle of once having really strong, intelligible conversations have now been diminished significantly. That's another hard thing that I've seen caregivers have to deal with.
Yeah, because I'm sure it feels like you lost that person. Like, they're not the same.
They're slowly slipping away, and they actually have a term for it now. It's called ambiguous loss. So you're losing that person while they're still here. You're grieving that person, and you're grieving what they once were and what they once had, and then when that person passes away, you grieve it all over again. So it's a hard thing. It's a terrible, terrible disease.
Gosh, it sounds like it. Because I'm sure we've all been affected by it in some way. Like, we all know that person in our family or our social circles who has or dealt with Alzheimer's and dementia, and it's just
It's terrible. The latest studies with the Center for Brain Health from LSU said that there, in a 75-mile radius of the med school, there's 85,000 people that have been impacted by Alzheimer's. So that's diagnosed, family members, friends, and that's a really big number.
yeah.
And the numbers are only going to increase. There's 92,000 people that have been diagnosed in Louisiana, and that number is going to increase in 20% by 2025.
Goodness. And so is it becoming like is it growing, like Alzheimer's and dementia?
Yes,
Okay.
it is. And we're living longer as a society. I saw on Facebook the other day, it was a lady who was like 112
Goodness.
and still sharp as a tack.
Really?
Yes. So, and there's no cure for it. There's no explanation, and it's hard for people to work through that because, there's 8-9 different types of dementia out there. Alzheimer's being the most diagnosed. But having to deal with someone who could have early onset and it could hit them in their 40s to 60s, to the other end of the spectrum is someone who's 85, 90 years old getting dementia. So there's such a wide spectrum that they're having trouble figuring out what's causing it.
Yeah. So is it also increasing among the people who are like the 40 to 60 range?
Yes, the numbers and statistics and stuff are showing that there is an increase in early onset Alzheimer's, so that's anybody before the age of 65, but there's also a dementia called frontotemporal that hits like late 40s to early 60s. That's what Bruce Willis was just diagnosed with.
Okay.
So, and that one affects your behavior, personality, and your speech.
So is it that, and I have no idea, and this is just me thinking out loud, is it that you think dementia or Alzheimer's is becoming more prevalent, or that we're just becoming more familiar with this disease and recognizing the different variations of it?
I think it's a little bit of both. So, 50 years ago, it was considered, someone's going senile or hardening of the arteries and things like that. But it is also becoming more prevalent because it has a lot to do with how we exercise, what we eat, and what we do as a society. And, if you are eating right, if you have good heart health, you've got pretty good brain health. And exercising, eating a well-balanced diet, not a high-fat, high-sugar, high-processed diet, you're reducing your risk, and so you're doing pretty well in regards to Alzheimer's and dementia.
Okay.
Is that going to prevent it 100%? No.
Yeah.
Because there's people who are, in the perfect health of their life, and they can get Alzheimer's. So it's going to reduce your risk with how you treat your body. So
Nice. And so the things that we can do right now for, I guess, anyone listening is just make sure you're living as healthy of a lifestyle as possible.
yes.
Okay.
The big thing is to limit sugar because diabetes puts you at an increased risk of developing dementia. Exercising, 15 to 20 minutes a few times a week, getting your heart rate up because the better your blood's flowing, the better it's getting to your heart and to your brain.
Yeah.
And limiting the processed and the preservatives in your diet.
Nice. Just that general health stuff.
Yeah. That we never really, it was like, do I really have to do this? They've said it forever. You need to eat healthy and exercise. But now I think people are going to listen more because dementia and Alzheimer's is becoming such a big issue. It's almost, it's the 5th leading cause of death in America.
Really? I didn't know that it could actually the disease itself could lead to death.
Yes, because if you think about it, your brain is deteriorating, so it's atrophying or dying.
Yeah.
And there's parts of your brain are dying, so how you walk, how you talk, and then how you breathe and how you swallow, things that those parts in the very end are the parts that die, and so then your brain forgets how to breathe, and a person can die from Alzheimer's.
Goodness. So it's not so much that the disease I guess the disease itself kills you, but it's almost like the byproduct of Alzheimer's, and that you forget like how your bodily functions
Right,
are
exactly.
lost. That is terrifying.
Yeah, it is. Sorry, got a little depressing.
No worries. So how did the bridge get started?
So it originally was started in 2007 by a bunch of volunteers in the area, and it was called the Alzheimer's Agency of Shreveport-Bossier. And it was just a bunch of volunteers, and they actually carried around the helpline. It was a cell phone, and it just went from person to person, and they were trying to help everybody that they could. But they decided they needed a physical staff to start helping and doing things. So 2019, they became an official 501c3 nonprofit, and our now executive director was hired in 2021, and so we've been the bridge since 2019. So
Okay.
we're still a relatively new and young. We're only 3.5 years old, even though we've unofficially been around since 2007.
Yeah.
But this group of volunteers saw a need in the area and just did what they could, and so now we're carrying on that legacy.
That's incredible. So starting in 2007, it was just people who cared about other people who had Alzheimer's and dementia, and serving those people. And now it's just grown into what the bridge is now.
Yes.
That's great.
So now we have 3 full-time and 3 part-time staff right now. And we're growing and getting the information out there, but there's still so many people in Shreveport-Bossier alone that don't know we're here and we're here to help.
And so how do y'all use volunteers?
We do, so for all of our programs that we do something once a week at either our office or like the programs with North Methodist. And so anytime we have like a program or an activity or something, we use volunteers. We do volunteers for like our education conference. It's in November.
Okay.
And we have volunteers that come help on the day of, just help navigating people and helping them to their seat or finding the bathrooms or anything like that. We always enjoy having volunteers for that day as well, because it is such a big day.
Yeah.
But another way we do that is through support groups that we do for our caregivers. So over half of our support groups, I think it's over half, have a volunteer facilitator that has gone through our facilitator training, and they actually do the support group and help those caregivers during that support group time.
Goodness, that is quite a bit.
Yes, so it's we have, I think, 12 support groups right now. So and we're trying to get them more, obviously, as much as we can. My lofty goal was to have 20 by the end of this year. So if I get to 15, I'll be doing good. But we have a lot of people that are interested in doing more support groups, and we actually have a support group or a facilitator training at the end of September.
Okay.
And we've got some more people that are wanting to start other groups, and just get them all over the place. That's my goal, is to get them all over.
That's great. And so what is a support group?
So it is a safe space for these caregivers to come in and ask for advice, to vent, or just have a little peace and quiet for an hour, and to know that they are not alone in this journey. There's other people right in Shreveport-Bossier that are struggling with it just as much as they are. So they feel like very much a community, because once they start going to a support group, they really kind of stick to that group.
Yeah.
And that group becomes like a family to them. So they really do enjoy, and they can call and lean on and ask for advice when we don't have the group, and just be there for one another and check in on each other.
That's great, because I mean, it's a life situation. Like, you're literally going through life with someone else. Like, it's not like a phase where
Right.
I need help for this thing that we're going through right now, but it is just one of those like life situations that people get to walk through.
Yeah, and so they get to help each other and walk each other, and may not be able to do a whole lot, but being there for that person is sometimes enough for that caregiver.
I'm sure the wisdom that compounds there is incredible.
Oh, yeah, because, somebody can come in and go, well, I'm having trouble with this. And they're like, oh, we had that, we tried this, or someone told me to try this, it didn't work, but we did this instead. So they're great at offering help and advice and not telling them, this is what you need to do, but saying, this is what worked for my husband, my wife, my mom or dad. This might help y'all too.
I'm sure that's great because I'm sure Alzheimer's and dementia presents itself different, but also the personality that's involved with the disease as well.
Yes.
Affects it really.
Everybody is different. Every symptom. I mean, they all have, obviously memory issues, but everybody's symptoms and signs and things are going to be different, and that's the frustrating thing that the researchers are finding.
Yeah.
They can't find the root cause of it. So.
Goodness. So, I'm guessing that if someone had either they needed help or a support group themselves or wanted to get the person they knew with Alzheimer's and dementia into a support group, they would just call the bridge and y'all would be able to tell them what support groups are close to them or...
Yes, so if a caregiver is interested or they want to get information for a friend, they give us a call. We've got a list. We can either email them or mail them or tell them over the phone what group is closest to them, and then... if they want a contact for that group, we can give them the facilitator to contact so they know somebody when they go in. And it makes it a little less awkward when you know somebody or you know of somebody that's going to be there.
Yeah.
It's because with anybody, you going into a new situation, it's a little awkward and nerve-wracking. So having a point of contact is good as well.
Yeah. And so the support groups you'll have now are spread out across the 9 parishes in Region 7.
So they are mainly right now in Caddo and Bossier Parish. There is one in Natchitoches Parish, and there's also one in Sabine Parish and Manning.
All right.
I'm trying to work and start getting some in the other areas as well. That's on my to-do list for the rest of the year.
That explains why the goal is 20. Because, I mean, if they're all right here in, the Caddo Parish and this area, like that's a large area to cover those 9 parishes.
Yes.
So,
and the
definitely sounds doable.
More rural areas. So, we do have one off of... it's Trinity Heights Baptist Church, so hitting that Blanchard area. I want to get one, in the Keithville, Stonewall area, hitting the more rural areas where there's at least one in that area, and they don't have to drive all the way to Shreveport or Bossier to go to a support group. And we do actually have an online one now.
Okay.
So we're doing a Zoom support group.
Yeah.
And we've had some really great responses, and we're trying to reach the people that either can't leave their house or people that are still working and are on their lunch hour. Anybody that, needs that help, we're trying to reach them and accommodate them any way we can.
Yeah. And so people who start these support groups, is it usually like a faith organization or just like a community center?
A little bit of everything.
Okay.
A lot of them are based in churches. But we have one at a council on aging in Benton. A lot of them are churches. There's some in the assisted living facilities. There's like Savannah Grand and the Blake and the Glen off of Florida Lucas does one. So they're in a little bit of every place. But if someone is interested in starting one, we just need a room that's private, and they meet once a month for an hour.
Okay. And what are the sizes of these groups usually?
They can range from 2 to, I think we've had as big as 12 in one group one time.
Okay.
So, and as each group meets, the sizes ebb and flow because they may have something going on that day, or it may just been a bad day and that caregiver can't leave. So normal is about 6 to 8 people.
Okay.
So, and that's a really good group size. In my opinion.
Yeah, that works. And so are there like ideal locations, like the places that you would like to go to get to that 20 goal? Like, are you wanting to expand to, I guess, non-faith, like a place outside of a faith-based organization, or does it work best if it's in a church?
It really, as long as there is a room, and if it's like a business, and they're like, you can use our room or our building, and then we would just have to get a facilitator to help with that meeting, and then that's all we really need. It doesn't have to be a church. It can be a community center. It can be a business that has a conference room that lets us use it. Anything like that, because we just want to be able to offer these and help the community.
It seems like it'd be such a valuable resource.
Definitely. Our caregivers are very much enjoy and need that support group time.
Yeah. Especially with, you said 80,000 people are affected with it.
Yeah.
Or affected by this in what region? Like just in Shreveport? Or
75-mile radius of the med center.
Okay. Sheesh. So yeah, there are definitely people that can use this outside of Shreveport and Bossier.
Yes, definitely.
And so I guess the goal in the future is to expand to those 20 centers. Are there any other goals for the bridge?
We're just trying to get people and let them know that we're here and we're available, and we're willing to come to you in any way capacity. If they have struggles or things like that, we are willing to go to them. If they want us to come talk to a group of theirs or an organization or anything like that, that is our outreach, and that's what we enjoy doing. Myself and my executive director go to like Optimist clubs and Lions clubs and let people know that we're here and we're available, and we're just here to help.
Yeah, that's great. And so how does First Methodist play into the Bridge Resource Center?
So First Methodist has always been a great proponent of us and all of our organization things that we do, but y'all have sponsored our conference the last couple of years, and we actually do it here, and y'all are our host sponsor.
All right.
So this year it's Friday, November the 3rd.
Okay.
And very excited about it because, again, it's here. We've got all the room in the world in Bain Hall, and the entire staff and community of First Methodist has always been so welcoming, and anything that y'all can do to help, that y'all are help on the day of, and y'all are wonderful.
We're glad to help, always. And so what happens at the conference?
So we have local and this year international experts come in to talk about Alzheimer's and dementia, but also as a caregiver and how to communicate and work with your person with dementia. We have a lady named Nancy Brown, and she is a certified validation teacher through the Validation Institute. And so that is a particular type of method to work with people with dementia. And she is from Jerusalem originally, but she is wonderfully going to be in the States, and so she's coming to be our keynote speaker for this year.
That's incredible.
Yes. So she actually works in a care center in Jerusalem for people with moderate to severe dementia.
Huh.
So she is going to be our keynote and talking about, how to work and communicate and just have a better quality of life with your person with dementia. And then we've got breakout sessions for professionals in the afternoons on diet and brain health. It's how to empower yourself as a caregiver, depression in the elder community. So, and these sessions are not just for professionals, but we're offering continuing education credits for nursing, social workers, and case managers. But we gear a lot of it towards the family or at-home caregiver, because that's who we see so much of. Yeah.
So is this open to anyone, or do you need to have an invitation to come to the conference?
No, it is open to everyone. We'll be doing registration soon. Our website is getting tweaked a little bit.
Okay.
But we'll have that on our website to register for it. And I want to say it's $25 or $30 for the general public to register.
Okay.
And they get breakfast, lunch, snack, and all the water and coffee that they can drink.
All right. And so do you happen to know the web address? And if not, we can just put it below the video whenever this comes out.
We don't have it yet, but it should be on our website at alzbridge.org under the events tab. So it'll be on there.
Okay. Well, we'll definitely put that on our video and then let people know they can go there.
Okay.
And so how can we, as First Methodist, continue to help you?
If anybody would like to volunteer, we are always looking for more volunteers for our programs at the conference, different things like that. Or if y'all are interested in doing a support group here, we would love to talk with y'all about support group. And if somebody's interested in that, we would love to expand to y'all and really hit the downtown area, because I know there's people that work in downtown that would need that needs that help.
Yeah.
As well. So
is there a support group in the downtown area? Or?
There is not.
Okay. All right. Well, we'll issue the challenge then.
Okay. Wonderful.
All right. Well, Laura, it's been great talking with you.
Yes. Thank you so much for having me. I appreciate it.
All right, guys. We will talk to y'all next time.